News today, we've heard about Governor Abbott in Texas dropping all restrictions. I know he's doing what he believes is right for Texas. What do you think is going to be right for Georgia based on everything you've just said? When is that going to happen in Georgia?
Well, that's something that I'm certainly looking at. I mean, I think a lot of the things that he's gotten rid of, like the mask mandate, obviously we didn't have that here. If you look around now, people aren't arguing about the mask mandate anymore because Dr. Toomey and I believe that people wanted to do the right thing. We just had to ask them to do that. The science is behind that. It's been very convincing, I think, of the number of people that you're seeing wearing a mask, continuing to follow the social distancing guidelines. It's a good time to remind people, just because we're doing a lot at our vaccine sites, we can't let our guard down. We got to keep doing this for another month or two and get closer to true herd immunity. But I just feel like we're starting to see the light at the end of the tunnel. Because of the amount of people that have now gotten the vaccine, the amount of the supply continues to increase week over week, and I do believe we're going to get to that point where instead of going up by additional 50,000 doses a week, it's going to go up by 150 or 200,000, and we're going to be able to have even more providers given the vaccines. We're going to be able to expand further mass vaccination sites or send more vaccines to parts of the state where, quite honestly, we haven't had to do mass vaccination sites because, like Augusta University is doing such a good job. The hospitals and the public health department in Athens are doing such a good job, and that's been the case in other areas around the state as well. But we cannot let our guard down. We got to keep working on all fronts to get back to normal, and that is to get shots in arms, but also just hang in there. Just hang in there for a little while longer and follow the guidelines, and let's keep our numbers where they are and fight through this here for another month or so.